Hi everybody, in this video we're going to demonstrate a HVT manipulation for the femur in the acetabulum, and this can be used for capillary restriction and or limited movement within the acetabular itself. Okay, so to move forward with the adjustment, we're going to sit adjacent to the injured side or the affected side. We're going to ask the patient to actively flex their knee and their hip. Now from here we are going to place the patient's gastroc or distal end of their tib fib across my shoulder. I'm going to use the hand nearest the patient to slide down across the adductors, palp our way down to find the inguinal crease line between the abdominal area and the upper end of the femur, and make sure we're placing the knife edge of the hand with the palm facing towards practitioner for safety for both people. I'm going to clasp my hands around, and then what we're going to do is I'm going to encourage a little bit more hip flexion from here. I will add traction in an oblique fashion outwards towards me. So I'm going to traction out as I press forwards. Now from here I'm going to use a little bit of reciprocal inhibition. So I'm going to ask the patient to push their heel down, engaging the posterior aspect of the hip. So push your heel down and pull for 5, 4, 3, 2, 1. You can prime this at 1 to 2 reps, engaging traction and pushing forwards, and on the final movement we will thrust in an oblique fashion towards myself. So press again, we'll use the thrust at the end of this technique. 4, 3, 2, 1, and release, and thrust in an oblique fashion outwards towards me. And there you have it guys, another nice simple technique for the femoroacetabular to release any capillary restrictions or possible movement restrictions within the hip itself.